apologies?
Graham Ebers, Chris Trell and Katie Summers.
Okay, thank you, Madeline. Anyone else aware of any other apologies? Say now if you are. Okay, now next item is minutes of the previous meeting, which are on pages 7 to 16 of the agenda. I will assume everyone's happy with them unless people say so now. Okay, any declarations of interest, please say so now. Okay, then we're on to item 41, which is public question time, and I'm not aware of any public questions, unless you are, Madeline.
No questions.
Okay, right, then we're on to item 42, which is member question time. I know Rachel's here, so Rachel, if you'd like to ask your question, please.
Okay, thank you very much. The British Medical Association resolved in September 2020 that more needed to be done to ensure equality of medical treatment for BAME and for transgender people in the UK. 16.4% of WBC residents are BAME, and government estimates suggest that we can expect somewhere between 500 to 1,300 of our residents to be transgender. Failing to appropriately meet healthcare needs of minority populations can have serious effects on both physical and mental health, as we've seen recently with the much higher death rates of BAME people during the COVID pandemic. I'm hearing that BAME and transgender residents are experiencing issues as their healthcare needs are not always well understood by healthcare professionals, leading to problems with them getting the healthcare they need. With this in mind, how do we in Wokingham Borough plan to respond to this BMA resolution by, for example, consulting with these communities on how we can improve the way their physical and mental health care needs are met, by bringing our healthcare professionals into this dialogue, and by continuing as a council to monitor how well these residents are supported?
Okay, thank you for your question, Rachel. The answer has come partly from WBC and obviously partly from members of the CCG, because it's partly a healthcare response. But the response is broken down as follows. Section 1, how the council will consult. Section 2, how the council will bring in healthcare professionals. And Section 3, how the council will monitor resident support. With respect to Section 1, organisations across the West Berkshire Integrated Care Partnership, the ICP, are engaging with various protected characteristics groups, and we are looking to identify and share this intelligence across partners as part of our ongoing approach to tackling health inequalities. This includes work with the voluntary and community sector organisations and with various faith groups. We are particularly looking to engage with BAMER, Black, Asian and minority ethnic and refugees communities, given the disproportionate impact of COVID-19 on these communities. With respect to 2, which relates to how the council will bring in healthcare professionals, we can assist in facilitating the involvement of relevant healthcare professionals, whether from providers or from commissioners. We have a great diverse workforce with BAME across the ICP, the West Berkshire Integrated Care Partnership, to contribute and support delivery. With respect to 3, which is how the council will monitor resident support, both the Royal Berkshire and Berkshire Healthcare NHS Foundation trusts are currently considering how to better understand differences in access and outcomes for different patient groups. In addition, Berkshire Healthcare are also co-producing priorities for improving the experience of the trans service users. Working with system partners, we're now building on how we can engage with various communities and looking to co-produce improvements, as can be seen in our early work with respect to COVID-19 vaccine take-up. Recently, the CCG secured 2020-21 winter pressures funding specifically aimed at supporting the mental health of people from BAMER communities over the winter. And the CCG is currently considering how best to ensure health inequalities are fed in and are a priority for the ICP in 2021-22. Do you have a supplementary?
I do. Thank you very much for that answer. So one of the most critical issues in UK healthcare right now is, of course, tackling the reluctance of some groups to take the COVID-19 vaccine. And this is a particular issue in some of our BAME communities. So I was really pleased to hear at the exec in February, the council and local GPs are taking steps to address vaccine hesitancy through communication and through working with community groups. There was a suggestion, however, that we'd certainly be doing more if we can get more data from the clinical commissioning groups. And that caveat worried me a bit, because that further and better data, it may or may not be forthcoming. Councils around the country are involved in some great initiatives, including virtual events to dispel myths and circulating guidance in a variety of different languages. Will Wokingham Borough Council commit, regardless of whether or not we get more data, to look at what the best practice is for reaching all parts of our communities and adopting those which are going to have most benefit for our residents?
Hi, Charles, actually it's Debbie.
Yeah.
I know I'm not unitary and I'm the CCG and the NHS, but actually we have gone ahead with this. Katie Summers is heading up the health and equalities, particularly over COVID, and having weekly meetings. And as you said, you know, our unit authority colleagues, voluntary groups and community support workers have been absolutely fantastic about, you know, giving us the on the ground intelligence of what actually is being said, rather than what we hear in the news or what we think is being said, and working with those groups. Hopefully the intelligence is coming. I don't know if you were on the call just before we started the meeting. The CCG, well, particularly Andrew Price, we're using the GP data, which is 4 days out of date, but he's able to cut it and give you some intelligence down to ward level of those people, the uptakes and things like that. But, you know, we are heavily working with your community groups to have the local intelligence. So if I could speak on behalf of the unitary, you're already doing it. Fantastic. But I think also, building on your first question, it has really opened, I think, everyone's eyes about how different groups portray, you know, the government, you know, the health service, and, you know, their concerns about everything, really. So I think, well, I'd like to think that we continue to work differently with all these groups going forward, given what we've learned during this COVID outbreak.
What I would add to that, Rachel, basically on WBC, just a little bit of fill on top of that. Myself and it's normally Matt or Martin basically meet the PCNs at least once a week and have discussions basically about what they need to support vaccine delivery. And I think, you know, some of the Amit, one of the actual PCN leaders, has done several videos targeted at the BAME community, because there is a consciousness of the need to send out the right messages. And we as the council basically are, you know, trying to push and support these messages as well. So there is a dialogue between us and the CCG, trying to make sure that these things get nailed.
Fantastic. You know,
I can't hear you, Rachel. I don't know
Sorry.
if it's just me.
Do you mind repeating that, because I lost you as well?
Okay, sorry. Yes, for some reason I was on mute. I was just saying that, so best practice support is going to continue in Wokingham regardless of what data we are able to provide.
That's our aim. Yeah.
Fantastic. Thank you very much.
Okay.
Cheers.
Cool. Now I'm not sure if Gary Cowan is on the call. He is question 2 if he is.
He's not on the call, Chair.
Okay, then he will get a written answer to his question. So if we move on to item 43, which is Health Watch reports, which is on page 17 to 78 of the agenda, and I am looking down the list about who's going to present this. Is Nick on the call?
Yes, I'm on the call.
Okay, would you like to introduce this?
Yeah, so this was a submission of several reports that we've done over the last few months. The perinatal mental health report that my colleague Jo primarily responsible for, and she's on the call if anybody's got any questions about those. Our COVID-19 survey about people's experiences during COVID-19. In fact, that was replicated across West Berkshire and Reading Health Watches. So I think in total there are nearly 700 responses. And whilst we've all done our individual reports, they are going to be pulled together as one report, but that's not finalised that. And out of that came several issues, one of which was people's difficulty in finding information during COVID. So we would get lots of requests from people saying, I've been looking for this information, I can't find it, it's not easy to understand, I can't get it in easy read, I've been looking on GP websites, can't find the information I've got or know whether I'm going to be safe. Searching for a dentist, can't find the correct information about dentists, about what I do during COVID. So following on from that, we did a report on GP websites, which was a mystery shop with the support of the Class Learning Disability Group, asking several questions. Can I find this piece of information? Can I find that piece of information? And from that, we produced 6 recommendations, which I'm pleased to say the CCG have said they're going to implement all of those recommendations. So making changes to the websites, not only in Wokingham, but across West Berkshire. Supplementary to that, we found during our carers survey, which we're currently carrying out, that some carers have found it difficult to find information about how to register. So we're going to do a piece of work around that to see if there's any consistency around carers information on the GP websites. We also did a mystery shop, again, with the help of the Class Learning Disability Group on dental websites. And there were 3 findings that came out of that. I mean, it's disappointing. We submitted it to the local dental council and their response was, well, we don't have any authority to ask the dental practices to make changes to the website. So yeah, that's just a summary really, and I'm not going to go through all the reports. We don't have enough time. It's just whether members have any questions around that.
I mean, I think from my point of view, I thought this was an excellent series of reports and really bringing out what residents and the clients of these services actually find them. So I want to say a big thank you on my behalf. But any questions from anybody else in the meeting to Nick on any of the reports in this area?
Hi, it's Debbie. Yeah, I think it was great, and from a personal point of view, and particularly the maternal mental health, I have to say I was slightly embarrassed. It's not the standard of care at all that I see in my own practice. So there are several things there that were a concern. I mean, one of the comments was that currently there's no obligation to ask about mental health. Actually, there is, in the healthcare records, which are joint records that our ladies carry with them all the way through their pregnancy. So whenever they are seen, they take them to any clinical input. There is a big box that said discussed mental health. Also where was the lady by herself or with a family member. And I thought it was also disappointing because you carried out this survey kind of the back end of the summer, and actually all of primary care had been informed, sadly, about the increase of non-accidental injury that had increased during the first lockdown, and the real focus on mental health of our pregnant ladies. And I think, as you highlighted there, and actually, it's no good just talking about postnatal, depression. This starts either preconception or definitely during pregnancy. And many of us were actually asking, what support do you have with family members, and against probably government guidelines, but it was really important these people had support bubbles despite lockdown to support them going forward. The other group that you said you were looking at finding out about their mental health were the under 20s, under 18s particularly, and I don't know if you know, but there is a specific team that look after, and they do have a lot more support, particularly in the mental health, which is called the Poppy team. So if you do want to, liaise with the Poppy team to find out what's happening with this group of people, then it'd be useful. Also, I think it was really disappointing for me to read that these ladies felt as though they didn't have time at the 6-week postnatal check. And I can only speak from the 3 practices that I have worked in across Wokingham over the last, sadly, 25 years. I sound ancient. The postnatal appointment has been in all the 3 of those practices 30 minutes, and I thought that was standard. It is officially separated into 10 minutes for mum and 20 minutes for the baby, but actually that's not the case. It's one appointment. And certainly from my own practice and talk to colleagues in a few other practices, is because we've had the capacity, because we've done less face-to-face, there's not another person sitting in the waiting room straight after, and we've been doing more telephone consultations. Off during lockdown, postnatal, we've actually spent more time with these ladies. So yeah, I have to apologise on behalf of primary care, because it was quite upsetting to see that despite all this input, that these ladies have been let down.
Debbie, if I just slightly correct something that you were saying there. The engagement for this report was actually done pre-COVID.
Oh, okay. So I looked at the date.
Yeah.
Right,
so the date
okay.
the report was published was obviously later, but the engagement finished in February, so literally just before COVID hit.
Okay.
It would be really interesting to do it again and see whether some of those things that you've been talking about have made a difference in that focus.
Yeah, that would be fabulous. Yeah, brilliant. Thank you. Sorry about that.
To David.
Yeah, I just want to thank Have for doing this as well. I think it was a very good report, series of reports. And also, as Debbie said, they didn't hold back from saying when things were wrong. And sometimes you get reports and they're all a bit insipid, and they weren't. And I think that's good, because it's made Debbie sit up, and we don't really want her to, but it's made the primary care people sit up and say, well, are we doing the right thing? Is it the right way that we're treating these mothers and things like that with their mental health? And I think that's a very positive. And if a report is not a learning experience, it isn't any good at all. And that's what I believe these reports are.
Right. Any other questions or comments on that? I think my kind of closing comment on that is there are obviously things in there that good practice where it's being picked out, and also things that require perhaps a little bit of work or focus, basically. Now, what's the process about how some gains are made from this report, and how these things move forward?
Yeah, absolutely. I would agree. And I think that this could be a real opportunity. A lot of the things that were mentioned in the report as being really positive, like the groups that are run at the children's centres, the kind of peer support face-to-face, obviously it hasn't been possible. So when those things are restarted, are there things that we could learn from the experience of those mothers? But also, as I said earlier, I think, especially first-time mothers who have had their first babies, and all parents actually, not just mothers, during the pandemic, what has that experience been like? Because they won't have anything to compare it to. They won't know what the previous norm was. What do they actually want? If you talk about what are those services going to look like, or what support is going to be available, I think there's a lot of work that can be done going forward.
Okay. Right, thank you for that. So if nobody's got any questions on that, we'll move on to item 44, which is page 79 to 90 of the agenda, West of Berkshire Safeguarding Adults Partnership Board Report. I think that's Lorna, but please correct me if I'm wrong. Oh, Teresa, my apologies.
That's quite all right, thank you. I think Lorna may well be on the call as well, but I'm Teresa Bell and I'm the independent chair of the West of Berkshire Safeguarding Adults Board. So I'm here to present the overarching report, but to talk specifically as well about some of the good work that's been going on in Wokingham. So yeah, as I say, I'm chair of the West of Berkshire Board. I think most people will be aware that we're quite unusual as a board in covering 3 council areas. So what you will have in front of you are 2 reports really. There's the report that covers the partnership, which includes the other 2 neighbouring councils. And then you'll have a report that comes from Wokingham Borough Council in terms of their take and evidence on safeguarding adults locally. So you've got the 2 reports. And you'll see from the Wokingham report in particular, although it is touched on as well in the overarching report, that Wokingham worked really hard during that year of 1920, which seems decades ago now, given all that's happened in the last year. But you'll see that they worked really hard to raise the profile and the status and awareness of adult safeguarding by implementing a new way of working called the Adult Safeguarding Hub. And this was agreed at a strategic level under Matt's leadership to really make sure that safeguarding had the focus that it needs, and that safeguarding practice could become consistent and really understood across all teams. So there was a lot of work that went into that. And the Wokingham report also details, and I won't go through each of them, but Wokingham report also details the contributions that were made to the 4 main priorities of the Safeguarding Adults Board. We're a large board, and having 3 councils there presents its own challenges in terms of just keeping up with what's going on across such a large area, and also making sure that we take every opportunity to constructively challenge but also share really good practice. So I think although it's quite it can be quite challenging to manage a board across the 3 councils. I think it has real benefits in terms of being able to share good practice and challenge one another in a constructive way. Although I'm talking about the 1920 report, it just feels odd not to talk about what's happened over the last year in terms of the response to the pandemic. So with your indulgence, I'll do that, because there has been some brilliant work that's gone on in Wokingham in particular. So although I meet with the 3 councils in the board, I also meet separately with Healthwatch and the voluntary sector representatives, as a way of triangulating what I'm seeing in terms of data, what I'm hearing from the statutory services, and then being able to check that out locally in terms of how that's experienced by local people with Healthwatch and the voluntary sector, which is really helpful. And I think what's come across there is how very much the support that was offered to carers, particularly during the early phases of the pandemic in Wokingham, was really welcomed. So I think efforts were made to make contact with informal unpaid carers in those early stages, just to make sure that people were okay and that they were getting the support that they needed. That didn't happen everywhere, but it happened in Wokingham, and all credit. I think it was a really, really good initiative. Also set up was a COVID task force. So you've probably heard about all of this before, but it has to be mentioned as part of the safeguarding report, because obviously one of the big concerns throughout the last year has been just how we make sure that we keep a line of sight on areas where there may be hidden harm. So, where institutions may be closed, where people aren't getting visitors, just how do we make sure that those care homes are supported in such a way that quality standards and safety are maintained. And the COVID task force was set up to work with care homes and residents. by the council, and that's had a really positive response from local providers as well. So I just wanted to add those two bits on. So although they're outside of the year that I was here to talk about, it just feels really odd not to mention those, because I think they were particularly good pieces of work. So that's all I wanted to say. Happy to take questions, and thank you for the opportunity to present the report.
Thank you. I would say, having sat in a meeting with my equivalent number from West Berkshire and Reading this morning, I'm well aware of the different perspectives of 3 different councils, but that's another matter. Any questions? One from David. Go ahead, David.
Thank you. Just to say, I mean, it says that there was a 21% increase, but that seems to have been mainly because you were sorting out the real numbers rather than the imaginary numbers. But this year, has there been much of an increase? I mean, you said Wokingham's done some very good work and so on, but because of lockdown and so on, have you been seeing an increase coming through, or is that going to come through perhaps after lockdown?
That's what it's a really good question, David. Thank you. And I think we're most likely to understand what's gone on during lockdown over the coming months. I think safeguarding boards nationally are sort of preparing themselves for hearing more over the coming months as we move out of the lockdown stages. So there's been a national piece of work that's gone on just to try and understand on a quarterly basis how referrals for safeguarding have changed. And I think in west of Berkshire, we're pretty consistent with the rest of the country in not seeing huge changes. There'd be a sort of an initial drop at the beginning of the pandemic, and then it's kind of leveled out to referral rates that we might have expected before. I suspect, like you've just intimated, that we're probably going to see the true results of the impact of lockdown and pandemic over the coming months.
Okay. Any other questions? Susan.
Thank you very much, Chair. And Teresa, I just wanted to say, it's not a question, it's a comment, to say thank you very much for the report and the detail in the report, the time you've taken to do that, and to draw our attention to specifically draw attention to the great work that has been done. So, and it's really really appreciated that you've actually done that. And I've got to say that I was talking to a trustee of one of our charities as well. They stopped me and said that they recognised me with my mask on, and they said that how the difference in the way that the council is working with charities and in response to COVID now, and so that I think adds more texture as well to, I think, from my perspective, to what you're saying as well, because this particular board member said they'd seen an absolute visible difference and step difference. So that's really good feedback alongside what you've said as well. So, but Teresa, thank you very much. I really appreciated your words there.
Great, thanks, Susan. That's really good to hear.
Okay, any other questions for Teresa? No. Okay, thank you very much, Teresa. Then that's great, and thank you for bringing the report to us.
Very welcome. Thank you.
Moving on now to item 45, which is strategy into action, and I believe that is Ingrid.
Yes, good afternoon, good evening, Chair. Thank you. So I will be brief. You have the reports and the updates in front of you. For most of you, you will remember, although it's been some time since December, that we are developing action groups around each one of our strategic priorities from the Wellbeing Board. Those are now established and working well. They have all met at least twice, and the third meeting has happened or is about to happen prior to our next Wellbeing Board meeting in April. And this, I hope, or in fact I know, will be the last form of reporting in the old style of this narrative update, which I think needs to be updated, and that was part of the aim of these action groups. So I hope to be able to bring you new methods of reporting and new data within that at our next meeting. So each of these action groups, as I say, have been formed. What they have been doing, working across partnerships around each of the priorities, is to identify the priorities within that priority, so the focus areas that they're going to work towards and report against, both in terms of existing services, but also where gaps might be identified, where new collaborative opportunities might arise. So I'm looking forward to bringing you some of that reporting next month. As I say, we have reported before. As you can imagine, each of those groups is at slightly different stages of development. The creating physically active communities is much further advanced, and we'll actually have a reporting dashboard at the next meeting. The others are more focused on gathering the evidence and the data around which areas of the strategic priority to focus on. But any which way, we will come to you with both action plan and updates from these new action groups at the next meeting. In terms of key priority areas summary, the sort of updates, we have to acknowledge, similarly to the last reporting item, that we have been in lockdown since our last Wellbeing Board meeting, and so a lot of our activity has obviously been influenced by that. You've got the full report in front of you, but I'm going to just draw out one or two things for each of the priority areas. So around creating physically active communities, I just want to point out and highlight the increased volume and promotion of online physical activity content that has happened over the second part of last year, particularly in the last lockdown, and it has a much greater offer for children since December and from November onwards last year. And what we'd like to do within our physically active communities action group is look to see whether there is a role for that online content and online teaching beyond lockdown scenarios. So what role is there for digital type physically active interventions beyond a COVID restricted era, if we're getting there? And in terms of the social isolation and loneliness action group, I would like to highlight to you all that there has been an increase in alcohol and substance misuse related referrals across the last year to Wokingham's drug and alcohol services. This is around a 50% increase. It's in line with the national patterns and not unexpected, but it will form a priority of some of the public health service work across 2021 as we build on the effects of COVID and focus on what effects COVID has had for our residents. We know that alcohol related or alcohol use has increased significantly, both locally and nationally. So that will be something we'll focus on going forward. And lastly, in the health inequalities group, I just wanted to bring to your attention across the board, please, that we are in public health currently working with children's services on the re-procurement of the health visitor and the school nurse service across the borough. And we're carrying out a consultation as part of that re-procurement. So if that comes through your email, this is my plea, please can you respond to that consultation, as it will shape our health visitor and school nursing service going forward, which do play a vital role in both health inequalities, but also the care of children and families across the borough. And I just want to add to that we will take back the feedback from the Health Watch perinatal mental health report and feed that into the service development for the health visitor and school nursing contract. Thank you. That's it, unless there are any questions.
Any questions for Ingrid? David.
Thank you, Charles. Yeah, looking at the social isolation board, involved are involved in it, but it does seem fairly Wokingham Council heavy. Should there be more input from voluntary bodies like Link and so on, who are very involved in this kind of thing? Because otherwise it becomes top heavy just from a county, from a borough point of view. And also I just looked at this and I wondered who the members of the social action and narrowing health inequalities board was, because I think that's quite important too. And I think it's important to include the voluntary sector and, as you said, BME and things like that, so that you get a whole picture rather than just a council perspective.
Thank you. Absolutely. I think that Phil's hand might be up in response to that question, because he is co-chair of that social isolation group.
I am. Thank you very much. Just to say that the link visiting scheme are now a part of that subgroup, and indeed we have a wider representation from the Friendship Alliance too. So that is now a broader representation across the voluntary sector.
Thanks.
Debbie.
Yeah, it's just again on that social isolation. I think the unitary teams and voluntary teams have also been working hand in hand with some of our social prescribers working in primary care and doing some of that joint working about checking on people as well. So maybe that needs to be integrated, because I think what COVID has shown us is we are one and the same, and we don't want to double run, but we need to get the right person for those different individuals. And I suppose just a plea really about online children activity. The kids have gone back this week. Parents have hopefully reduced their wine intake this week as a result. But equally, some of these kids are bored to death of doing everything online. I'm not aware of that many children that actually have done their PE when they've been supposed to doing it. So just be aware, yes, there's learning, but actually we are creatures who like to see each other and have that human contact. And a lot of people just need someone beside them, giving them that active encouragement rather than just doing everything online. So yes, it's an option, but don't switch the other way.
And I totally agree, Debbie. Thank you. And I didn't mean merely actually for that learning around the children, but I do think that there is a certain group of adults in society that do prefer to exercise without the social a bit. So I think that we just need to cater for all of our residents, and if for those exercise is a social thing, absolutely, but for those who would rather or actually have been introduced to exercise through being able to access it at home, I think we need to try and maintain their involvement in that. So I think it's just that balance, as you say.
And I think the other which kind of comes across as a negative, but actually we could turn it on its head and actually say it's a positive, is about the increased referrals to drug and alcohol. Because previously, there's been quite a stigma and people don't always want to go to an agency because they don't know where this, it's going to lead with, their work or families kind of knowing or saying out loud to themselves that it's actually true. So actually the fact that, referrals have increased, personally I see as a positive, because potentially they could, as particularly with alcohol, I think it's difficult because everybody lies. In general practice, we always say think of a number and double what they actually say, if not more. So the fact that people are talking about it and getting referred, I think we just have to see as positive.
Okay, I'm going to go to Martin, then to Nicholas, please.
Okay, thanks, Chair. I was really just going to add a couple of comments to the feedback that Ingrid has given. And it was just maybe just for information, and we can maybe give more detail in future. But around these physically active communities, because of COVID and so many people being having to shield and stay in their own homes, there are a lot of older, vulnerable people who now are struggling to get out the door again. So we've just kicked off a project called Moving with Confidence, which is really using our sport and leisure staff to go in to people's homes and do one-to-one sort of training in their home to get them more fit and able to then start to be able to go out again. So that's a key project that we're doing, which is very much, the impact of COVID and sort of fits in with our physically active community. So that's a really positive project. We've also maybe just mentioned through our integration board, we are funding the Friendship Alliance to do further work on social isolation. So again, that will come through as further work. And I thought maybe it was worth mentioning around inequalities. We've been doing a lot of work because of mental health issues relating to COVID. And we've just basically signed off our sort of pilot mental health and early PCN, where we're really showing huge benefits, where we've helped a lot of individuals to basically manage their well-being, and we've been using the Warwick Edinburgh scale to actually show how a significant an improvement we have made with quite a number of people. So there are key things that we've been able to do which have been benefit from the COVID impact and have made a huge improvement right across the council over those 3 priority areas. So I think some of that will come through in more detail, as Ingrid said, in future reports, but there is really good work being done right across the patch.
Nicholas, did you want to ask a question or say anything? No. Okay. I think, Ingrid, my kind of concluding comment on that would be, it's quite obvious there's a really significant amount of work going on. Now, I think it's been brought home to me by discussions with a couple of our members, which you may be aware of, but I know Matt certainly is, that, we've got to somehow inform people of all these areas of work. Now, you mentioned earlier there's an action plan coming in the near future. At what point will we be able to publicise something to other members of this community and to the wider public as a whole? What point realistically?
Well, yeah, how are you going to hold me to the date?
No, not at all. I mean, it was just the relevance. The discussion I had with, well, I don't mind saying who it is. It doesn't really matter. Pauline Hellier-Simons plus a couple of other members regarding obesity, which I know Matt's aware of. I just thought, we're doing all these things. We're talking about all these things, but they don't know.
Yeah.
I think that's right, Charles. And when you listen to Martin there, I mean, there's so much work going on around each of those priorities. And unfortunately, the way in which it's been sort of, as I say, this narrative reporting isn't helpful to be able to draw out all of the work that's going on. So the first draft or the movement towards that will be next month, but I would imagine just a couple of months, so early summer, we would have a much better handle, and some each month we may be able to give an update of which there might be an extract to be able to pass around more widely. But certainly those reports will be public and obviously can go out, and hopefully will be more comprehensive and more easily digestible.
Thank you. That's fine. Right, if there's no other questions to Ingrid, then we'll move on to item 47, which is, item 46, update on the health and wellbeing strategy. And I think that's Sarah, if she's here. Yes, Sarah.
Yes. Hi, thank you for having me. So here to give an update on the development of the health and wellbeing strategy for Berkshire West. There is a bit of an update from the slides that were sent round in advance of this meeting as we've moved through the public engagement. But just to let everyone know that we're now entering into the final stage of the development of the strategy. So the public engagement phase came to an end on the 28th of February. That was the date that the survey closed. As we've mentioned previously, there was a number of running themes that were identified earlier on in the process. And so just to mention again, they include empowerment and self-care, digital enablement, integration, prevention and recovery from COVID-19. The public engagement for the strategy was quite an extensive We're grateful for everybody's participation in that. So we had a task and finish group that met weekly for a long period of time, and that included representation from each of the 3 local authorities, the 3 health watches, community organisations, the voluntary sector, and the CCG as well. The public engagement included an online survey, and that was promoted through the Wokingham Borough Council Facebook, Twitter and LinkedIn pages. It was sent to residents through general newsletter and the internal staff bulletin. It was also promoted via emails to people identified through the engagement plan, which was developed with different stakeholders. We used social media to specifically target 2 areas, including working in residents to boost responses, and we had a weekly download of survey responses so that we could specifically target areas and gaps that we'd identified of lower uptake. We also invited every town and parish council to engage and respond, and voluntary sector organisations were invited to respond as well. There were a number of focus groups held across the whole of the 3 local authorities, and particularly in Wokingham. Health Watch held a focus group with learning disability community and with carers. There were public meetings open to everybody. I think we held about 20, just under 20 focus groups in all, a variety of targeting older people, the general public, those from ethnic diverse communities, carers and young people, and also patient voice panels as well. We had some challenges in general because of the national lockdown, and that impacted our ability to hold focus groups and for the wider public to engage, which was why we did extend our period of public engagement to the end of February. We also found that, rightly so, COVID-19 communications often needed to take priority, and that limited how well we could promote the survey, particularly in the focus groups. Because of the nature of and we had to take the approach of focusing on groups and organisations that represent that community. And we also acknowledge that we've had less engagement than we would have liked from young people. We did try and target social media promotion, particularly at younger people. We used contacts at Reading University, acknowledging that people may attend there but live in Wokingham and West Berkshire. And we tried other organisations, but we still did have a lower uptake. I've got an update of the survey findings, which might be interesting if I just share, because it's an updated numbers compared to what was in the original. In terms of the survey overall, we had a total of just under 4,000 responses. Reading was 1,200, West Berkshire just over, and Wokingham in the end had just over 1,500 responses, which was great. In terms of the breakdown of who responded to the survey, we did have a higher proportion of females responding, and you can see the age distribution. And as I've mentioned, we had less uptake from young people and young adults than we would have liked, despite our sort of targeted efforts to try and increase uptake in that group. And this is the ethnicity of respondents. So the vast majority were from a white or white British background, although we did find that it sort of does represent the overall ethnic makeup of the population, however, slightly overrepresented, and that this is Berkshire West overall. In terms of organisations who responded to the survey in Wokingham, you can see as listed, so we had quite a variety and a number of different town and parish councils responded to the survey as well. So what we're now doing is using the update from the survey to really develop and refine our priorities. We started with 11 potential priority areas, and we're trying to refine that down to somewhere between 3 and 5. So when we look at a sort of simple ranking, this is what has come out from the results overall, and in the orange are the results from Wokingham residents alone, and in the blue are that from Berkshire West overall. And as you can see, actually we had quite close alignment through them. And what we did find as well is that even early on, so the 4 top are supporting vulnerable people to live healthy lives, helping families and young children in the early children and young people. And those 4 top priorities have actually remained consistently the top from the very start, even when we had quite low numbers responding. These were the 4 that came out early, and it's remained that way even as our numbers responding have increased. And we also find that those top 4 are consistent across the 3 areas as well. We also asked the question of how important each priority is to you, and it's a bit of a busy graph, but basically the blue and the orange are people the percentage of people that said either extremely or very. And again, we're seeing a similar picture that supporting vulnerable people to live healthy lives has come out as top. Good mental health and wellbeing for children and also for adults is coming out higher. and then followed by helping households with significant health needs. This is in the report that was given originally, so I won't kind of dwell on it, but we did ask the question of what we missed. Some of the responses that we had for that were actually kind of included in the priorities, but some were wider, particularly air pollution was one. And then this was a question on how much change do you think was needed, and really this question will help us to develop the specific priorities underneath, because we then went on to ask people what change did they think. And again, we had some examples of change, particularly focusing on sort of the health inequality side of this really, and being aware of where progress could be made. So just to highlight that the next steps now is we're taking this public engagement, doing the full analysis of the survey and focus group findings, and writing the strategy, and that work is ongoing at the moment. So it looks like we're settling on those top sort of 4 priorities, as I mentioned, and those will be used to sort of inform the final strategy. It's then planned to go to the individual health and wellbeing boards and the unified exec between April and May. The dates do vary depending on the area, and then we're planning on taking it out for a public consultation on the draft strategy itself, and that's looking at June, July time. We will then revise the draft based on everything that all the feedback that we've had at that point, and then will be back for final review by health and wellbeing boards around September, October time. So that's the sort of overall time frame.
Okay. Thank you, Sarah. Any questions for Sarah or comments? Looks like absolute silence, Sarah. So I will say thank you very much. And yeah. Oh, sorry, Susan, a question. I can see it's just come up.
Sorry, I'm just turning off my turn on my camera. Thanks for that, Sarah. I just wanted to just ask a question about the relationship between the work that you're doing in regards to the joint health and wellbeing strategy and the work that Ingrid was just talking about in terms of our local strategy. And I mean, maybe Ingrid can come on with regards to this as well, but I'm just trying to, in my mind, understand the connectivity between those.
Yeah, I mean, I think it probably does need a bit of a joint answer, and I think there's still some kind of fleshing out of exactly where they'll sit together as well to be done. I mean, I think there will be an overlap. This is a strategy that's going to be shared across the 3 areas, so it gives us that ability to have that wider, have things across a wider area, and involving different system partners. But then, and there is definitely an overlap with some of the existing Wokingham strategic objectives. We always sort of said that there would be work that was shared, but then each local area between the 3 would then have areas that they would focus on themselves as well, and it may be that it fits within that. But Ingrid may be best placed to answer exactly how it will work.
Yeah, so I think, well, interestingly, our wellbeing board strategic priorities come up. That plan was set to end in 2021 in March. So actually, if those were extended, there is a potential for the joint strategic priorities to become ours or not. Hence, it's coming back to the Wellbeing Board for us to consider or to inform where we go next. So as Sarah says, for those to be the broad basis and for us to look at the Wokingham need within those broad priorities and then have our a more of a focus on local need underneath each of those or in addition to those. So how it works is up to us to shape across the coming 6 months, really, especially if we know in advance, as Sarah's indicating, the likely priorities that are going to come from it, and we can see how that fits in with where our own board priorities lie. And I see Matt's hands popped up. So
because I think it is going to be really important to get early sight of that information, as you say, because what we've talked about previously is the importance of reflecting the local, our local sort of priorities in this, whilst recognising there will be, cross council priorities as well, but the importance of local and given what we just talked about in the previous item about the breadth and depth of work that's taking place under the current priorities that we have. But thank you for that.
Okay, I'm going to go to John, then to Matt.
Really very much on the same vein. Throughout this meeting, we keep on talking about Berkshire West. And whilst it's very interesting what's happening in Reading and West Berks, it's not terribly interesting. We have a focus on Wokingham. We have limited resources to direct to our strategic priorities. And we don't have resources to spend on collective priorities. So I'm quite alarmed at this meeting where more and more is being talked about Berkshire West, which we don't really have any stake in, and I'm concerned, very concerned.
I'm going to go to Sarah, if you want to say anything on that, or I'm going to go to Matt.
So I just, we talked about this a bit before, certainly what Susan said and then John following on. And what we agreed was that we were going to spend a bit more time getting under the hood of this a little bit at an informal session. We did set that session up, but unfortunately COVID kind of overran us. So I just wonder whether in the timescale we've set that we should perhaps re-diarise that informal session so that we can unpick some of those issues a bit more, make sure that we get what we want from the strategy for Wokingham and understand that, I suppose. So it's just a plea to maybe re-diarise. That would probably be May now, wouldn't it, Madeline? Given where we are with the rhythm of the meetings, is that right?
Yes, it would be May after the election.
Which probably fits, doesn't it, with the timescale?
And just to add to that, Matt, I would really agree with that. I've seen the work that Sarah put into making that session, the slides for that session, and it really does draw out quite how Wokingham can make its own strategic priorities within this joint wellbeing board strategy. So I think that would be really helpful for everyone.
But just to answer Ingrid, why does it have to be within a joint strategy? Why does it have to have that limitation?
Well, I think I see Merredin's hand up, so I think Merredin might take that.
John, I think the Wokingham Health and Wellbeing Board have got a really good model of priorities and their whole approach to it. And when we have this joint one, some of those will be fairly similar because you've already good handle on what the needs are in Wokingham, what you need to do. By having the Berkshire West one, it'll be a chance to hold the rest of the system to account. So what I would see is when we have 3 to 5 overarching priorities, Wokingham Health and Wellbeing Board will have its own plan based on those, which may not be a lot dissimilar to what you've got now. Then you'll have Royal Berkshire Hospital will also be held to account for those same priorities. The fire service will build their plans on that. The police will build their plans on that. And it'll be a way, and the whole of the ICS, it'll be a way of holding the rest of the system to account for those same priorities. At the moment, Wokingham are working on those priorities, but some things need wider partners to be doing things too. So I think it's a chance for the whole system to be working on some of the same things. So I think that's where I see the benefits. This isn't about Wokingham suddenly getting in line with everybody else. That's not what this is about.
I'm going to go to Susan.
Sorry, Chair, it's an old hand. I'll take that down now.
Okay, no, thank you. Any other questions for Sarah? Okay, I mean, I think to wrap up, Sarah, thank you for the report. I think it sounds like to me there would certainly be immense benefit in a meeting between yourself and the senior officers and possibly myself, and if he wishes to be involved, John, to kind of flesh this all together. I mean, I think, you know, speaking personally, I'm very aware of Health's wish to move to this Berkshire West model and this BOB system. You will no doubt have picked up the concerns amongst, you know, politicians here that Wokingham's, you know, our responsibility is, as per the council officers, actually, is to Wokingham residents. And much as I hear the argument Merredin's making, you know, some of that is not for us, basically. It's for other people to manage and other people to control. So, but I think in the spirit of being constructive and moving forwards with this, I think if we could get that meeting diarised, that would be most helpful. And then we could see where we go with this.
Yeah, I mean, I'm happy to support that meeting. As we said, we'd sort of done the preparation process, that's fine. If it's possible to happen in April, that would be ideal, you know, as soon as we can, but I can liaise with colleagues to organise that. The only point I did just want to add was that what we did find, you know, what we're doing is based on the engagement with the public, and Wokingham had a higher representation in that than anywhere else, and actually they were still saying the same thing, so we weren't hearing a different thing from different, you know, amongst the different areas. But so just to reiterate that, but thank you.
That message came through fairly clearly from your slides, so no, yeah, noted and understood. So no, thank you, Sarah. So if we can move on to item 47 now, Wokingham Borough Wellbeing Board terms of reference. Now it says on my sheet here, Andrew Moulton, though I can see he's not in the meeting. Is that you, Madeline?
I think it's Martin.
Yeah.
Martin, my apologies.
That's okay, Chair. Yes, Chair, this is really coming here for approval because we're really seeking to increase the voluntary sector membership on the Wellbeing Board. As you know, we approved a voluntary sector strategy last summer, and we're doing a lot of work in terms of trying to enhance and work closer with the voluntary sector. And you've heard some of the examples earlier in this meeting around the good work that the voluntary sector is doing with council. And what we felt was it was really important to actually get an additional member onto the Wellbeing Board so we can actually bring that added value from the voluntary sector into this meeting. To date, we've obviously had Phil Cook and now recently Phil Bell is here representing, but we feel that actually 2 members would be much better so they can actually represent the breadth of the voluntary sector. So the proposal today is to get approval that we will have we'll have an extra member from the voluntary sector attending the Wellbeing Board.
Looks like he's frozen there.
Yeah. Over to you, Debbie.
Yeah, thanks. Yeah, any comments on from the floor, David?
Yeah, I just think that's a very good idea, and perhaps we ought to have done it quite a long time ago, because the voluntary sector is working in partnership, and that's what it's all about. As I can't remember whether it was you or someone else said, you know, it's the 3 of us working together and complementing each other that is the way forward for this council, and for everyone. And so that's important that they are well represented.
Thank you. John?
It has my support.
Yeah, thank you, John. It definitely has my support. You know, I don't see it as different organisations. We're all in this to support our, you know, people living in Wokingham. And, you know, I think the stronger voice and from different agencies and the support we can have is, you know, fantastic. So definitely has my support. Charles, you're back. You froze for a while there.
I was suddenly talking and my computer had got a complete blue screen and I was aware oh God, what's happened? Anyway, thank you. No, I mean, that has my support. So unless there are any further questions, we'll move on. And I think the next item on the agenda is the forward programme, which is in obviously the agenda. Any comments, any questions on that? No? Miss?
Chairman,
Oh, Susan, my apologies. Go on. Hello?
I think it was. I think I heard Madeline.
Yeah, I thought I heard Madeline, and then
I don't know what she was going to say, but I wonder whether she was going to say the proposal before we all seem to support, but did we need to take some kind of formal vote or decision just to make sure?
Yes.
Okay, I can hear you,
Madeline.
Yes, sorry, I was having problems with my microphone.
So do we need to take a vote on that, Madeline?
Yes, please, because it will be noted by council.
Madeline, can you hear me?
Yes, I can. We do need to take a vote on the voluntary sex one because it needs to go to council to be noted.
Fortunately, Charles is frozen again, so could I suggest that Debbie, you ask for all those in favour? Put their hands.
Well, it might be easier because there's lots of people on the call to say the opposite. So anybody who has an opposition to that, can they please put the hand up or forever hold their peace? Then nobody's put the hand up. Charles, I don't know if you can hear us, but he's already given his agreement for this. So Madeline, can we take that as we fully support this? Thank you.
Yes, thank you.
And I've lost the agenda now, but I think from memory, if we move forward, it was just the forward programme. Is there anything to say on that, Madeline?
I've had one suggestion from Katie Summers, who has asked at the next meeting we have a discussion on the white paper on the integration and innovation working together to improve health and social care for all white paper, which came out in February.
Yes, I think that's a really good point, and I think picking up on concerns that were just raised about the Wokingham voice, I think it would be really good for Wokingham to discuss this. It's a little bit bare bones, but I think we would be good to discuss it so we can have a voice about how we want to work within Wokingham to feed up to the bigger system rather than be told what to do from the bigger system.
I couldn't agree more, Debbie. I've read the white paper and it's completely opaque. It's been written by people who didn't want anybody to understand anything.
I just think we have made such amazing inroads. You know, we particularly the integration board and working with our communities and voluntary sector, that we need to shape how we want to continue to work going forward. So I think it would be a good time to bring that paper to board. I would agree with that. Any other suggestions?
I agree entirely, Debbie. We've really worked hard, all of us, to make it a single effort, a single endeavour.
Yeah. Great. So if there are no other suggestions, then thank you very much. I think we've all had IT issues throughout the evening. So I hope you enjoy the rest of your evening. Thank you very much.
Thank you.
Thank you, Debbie.
Thank you. Bye.
Thank you.
Bye.